Great. Thank you very much, Steve. So as Steve mentioned, I'm going to talk a little bit about the key insights from a series of citizen panels and a national stakeholder dialogue that we convened about enhancing the use of technology in long-term care in Canada. So Steve, am I able to advance the slides on my own?
Yep. On the left side there of the screen, Mike, there should be the controls.
There we are. Thank you, Steve. Okay, so I'm just going to give you a quick outline of the project and our approach, and then walk you through the 10 key insights from the project itself, and then I can turn it over to Andrew. So context for this is that the project is funded through AgeWell through what they call a platform project, which is a project that's kind of designed to support the network as a whole. And our focus is more on the policy side of things, so supporting aging-focused, rapid learning, health, and social systems. What we were doing within the scope of that platform project is identifying 3 topics or more over 3+ years, and pressing policy issues related to technology and aging, and then working with our interdisciplinary steering committee for each of those topics, and then convening a series of citizen panels that are followed by a national stakeholder dialogue with the focus of generating insights and action. So we're guided always by the interdisciplinary steering committee of investigators and knowledge users, and supported through our partners, which includes the BC Academic Health Sciences Network, Trillium Health Partners, among others, and discussing the partnership, and then also with the partnership with the McMaster Institute for Research on Aging. So the key principles for our approach. This is both our principles at the forum and to underpin this project as a whole. And to be able, we feel as though being agile, collaborative, and impact-oriented are the 3 things that let us uniquely be able to respond to pressing policy issues. So to be able to be agile and to be able to kind of modify and shift as we go, and to draw on the comparative strengths of other teams, and always with an eye on trying to generate impacts, means that us, as well as others we're engaged with, can always go further or faster in attempting to respond to pressing policy issues, whether the timeline is hours or if we have longer in weeks or months. So our particular approach for this project, as I mentioned, was to convene a series of panels. And so what the panels in general aim to do is bring together diverse groups, usually for each panel, about 14 to 16 citizens, for a 1-day off-the-record dialogue. That provides them with the opportunity to bring their own views and experiences to bear on an issue. So we're wanting to hear what their experiences are, and then to also enable them to learn from the evidence and from others' views and experiences that are part of the panel, and then share those newly informed views about the issue and how to address it. So it's meant to be very much informed by a citizen brief that's a plain language summary of data and evidence about a pressing problem, 3 possible options to address and implementation considerations, and engage in a constructive deliberation. Now, during the COVID pandemic, we've shifted to doing this virtually, where we convene panels through Microsoft Teams, and did so over a 3-hour period instead of a 1-day period, but further informed the panels with a video presentation that was shared with participants before they came to the panel. And we found that given the constraints, it actually worked quite well for us in this context. So in terms of the overview of our process, we start always with consulting and working with key stakeholders. So that's through our steering committee, but it's also by taking drafts and other ideas and an outline of the brief to do key informative interviews with 15 to 20 experts and policymakers across the country, and using that input to prepare a citizen brief that, as I said, summarizes in plain language the key data and evidence about a problem, options, and implementation considerations. We send that to participants prior to convening the panel, along with the supplementary information like the video, and then we prepare a thematic analysis of the panel or panels to identify what are the key experiences that were articulated during the panel and the values and preferences for addressing it that emerged during the panel. And then in the next stage, we aim to support action through the citizen panel by sparking action through another stakeholder engagement process that we call Stakeholder Dialogue. So we typically pair panels to be convened first, and then pair it with a stakeholder dialogue with policymakers, stakeholders, and researchers. Gets informed by a more detailed evidence brief that includes findings from the panel, and then we convene off-the-record deliberations. So again, these are typically a full day set of deliberations, but in the context of COVID, we convened it across 2 days. So the same amount of time allocated, but just breaking up the days so that it's not a full day of online meetings, one online meeting. So in terms of this project, what we did was convene 4 panels in early January, each with about 18 to 15 citizens, and were diverse in terms of age, gender, ethnocultural background, and socioeconomic status and lived experience. We were recruited through a panel called Asking Canadians, purposefully to try and make sure that we were diverse across all of these different types of demographic variables. And then, I'm just advancing the slide. There we go. And then our national stakeholder dialogue followed that in early February, again, split across 2 days, where we had 7 senior federal, provincial, and territorial policymakers, 5 senior managers and leaders of organizations, 2 people from industry, and then 6 researchers, and off-the-record deliberations. So in the next few slides, I'll just share with you the key insights from those 2 projects, roughly half and half from each of them, to give you a sense of what we found. So in terms of the evidence brief, we frame the problem in relation to several factors that make it hard to identify and harness the potential of technology in long-term care homes. So this included these 4 broad themes. As you can imagine, in the brief, we had many more kind of examples and details about each of these. But the first is that residents of long-term care homes have complex health and social needs, and this has been increasing over time, which means that we need to think through what are some other supports that we can both help staff as well as residents in managing those complex health and social needs. Combined with that is that there are many long-standing issues in long-term care sector across Canada. Many of these have had a spotlight shone on them during COVID, but they've in reality been there for a very long time. Things like staffing ratios, older buildings and infrastructure, and all those things kind of combine to make the situation during COVID even worse, but there are things that have been long-standing and need to be addressed to strengthen the sector going forward. And then paired with that is the fact that the full potential of technology isn't being used to address these issues and improve the quality of life for residents, caregivers, and their families, whether it's from addressing social isolation to connecting them to better connecting them to their care, either virtually or to their health records or whatever it may be. Technology can have a big role to play in ensuring kind of person-centered care within long-term care. And then there are many barriers to designing and using technologies in long-term care homes, whether it's from infrastructure to engaging people in those design processes. So the second piece here is also from the brief, just to give you a sense of what we framed. We put in front of both panel participants and the dialogue participants 3 elements of what we saw as a larger comprehensive approach that could be used to enhance the role of technology in long-term care. The first was around ensuring that homes have the supports they need to use technologies. And so this could be kind of thinking through critically how to go back and improve infrastructure in existing long-term care homes, but also plan new homes and the infrastructure that might be needed to support the uptake of technology. The second is engaging long-term care home operators, staff, residents, their caregivers, and industry in developing and adopting technology. So what we call a co-design approach, and then would involve all of those people. And then the third is to think through this kind of rapid learning kind of model. So how do we enable a process of making small yet rapid changes that are centered on residents, caregivers, and families to support the development and evaluation of technologies over time? And so rather than kind of making one decision and assuming that's going to solve all the problems, but instead a rapid innovation cycle and a very new way of doing things. Okay, so in terms of the findings from the panels, the challenges that were identified by citizens, you can see them as kind of in 2 big buckets. One is about kind of broad-based challenges in relation to long-term care specifically, and the other towards the bottom set of the bullets here are about technology. So unsurprisingly, citizens viewed very strongly that long-term care is underfunded, that social isolation and loneliness are common both in normal times and especially during COVID, especially during times of lockdown, And many articulated that they, in the current form that it takes, that they don't want to end up in a long-term care home. So those were kind of the three big picture challenges. And then in relation to technologies, the pervasive view across all four panels was that the long-term care just isn't taking advantage of the potential of technology that it offers. Again, whether that's for things through like communication technologies to things for keeping people safe, like motion sensors or other types of technologies, just not being harnessed in the way that they could be. There's also persistent myth that older adults aren't interested or are unable to use technology that we know is not necessarily true, especially with perhaps with some supports in place to make that happen. The uptake of technologies, however, if not supported across the system, could in fact also increase inequity if only people are able to pay or getting access to it and leaving others behind. And community resources are not optimally leveraged, whether this means kind of bringing in internet connections, harnessing things like libraries and other community resources to keep people connected and engaged, and that can be done through technology. And some critical infrastructure in addition to that is not in place. So just, for example, basic Wi-Fi within long-term care homes. So the fourth insight, again, from citizens' values and preferences, and the most consistent value and preference that came out across the panels was that co-design was viewed as essential across all three elements that was in the citizen brief. Participants very strongly said that co-design should be used to plan the renovation of existing long-term care homes and the building of new ones, but also should consider not only the physical and technological environment, but also the broader social, culture, and policy environments that can support adoption of appropriate technology. So co-design was seen as important to underpin any actions going forward. In addition to that, other key things that came up from the panels was the need for national standards and guidelines for enhancing long-term care that need to be met provincially. And we now see some of this work underway through the Canadian Standards Association and others through with funding from the federal government in the most recent budget. And then secondly, with some of the challenges facing long-term care, we're seeing as, they could be addressed with technological solutions that are perhaps cheap and simple. We don't always need to view technology as being a large, expensive undertaking. So the sixth insight here is just that the key challenges that were noted during the dialogue. So here transitioning to what the stakeholder dialogue, the policymakers, researchers, other leaders across the country were saying, and kind of building on what the panel participants said. So first was that there was a strongly held view among the group that there's a lack of a comprehensive innovation agenda for long-term care, something that articulates the kind of course we need to chart going forward and what that might look like and how dramatic the changes might need to be going forward for long-term care. The second is that residents, families, and caregivers are rarely and inconsistently prioritized and meaningfully engaged. So re-articulating that finding from the panel about lack of co-design. Also, that technology is often not attuned to individual needs of residents and local realities, and that the long-term care sector wasn't viewed as an innovative space overall, and where the value of technology could be often questioned, and that could be for a variety of reasons, whether it's technology being viewed potentially by staff as a surveillance mechanism for performance versus just not seeing the overall value in it in a way that can enhance the quality of care or quality of life for people in long-term care homes. Number 7, the key insights about the elements from the dialogue. There is a strong sense that we need to reimagine long-term care using a co-design approach and therefore focus solutions on what long-term care is or should be. So again, this co-design being very fundamental in the findings from this project. Addressing the many large structural and long-standing issues was also emphasized. So things like implementing standards across the country using a quality lens, supporting coordination within and between governments for technology innovation. So many people talked about not always knowing what other provinces or territories are doing, and there's very excellent examples of scalable solutions that could be adopted by others if only a more coordinated and collaborative approach were taken, and addressing the many challenges that are present because of very long-term care ownership. And lastly, ensuring ongoing and meaningful engagement of residents, families, and caregivers in technology development was seen as a very important component of this design approach. So the eighth insight, what could an innovation agenda look like? So there were three things that we discussed during the dialogue. One could be more of an incremental approach that focuses on short to medium term goals for enhancing quality of care and care processes within the existing structures. The second is taking a step beyond that, some more disruptive innovation where technology can be used to significantly change the long-term care sector. So bigger picture changes. And then the third was even a further step beyond that, which we called radical innovation, which would involve a full rethinking of long-term care for the digital age. And so, of course, as you move down this list, the window for action kind of becomes narrower, and the sense among the dialogue participants was that if more radical change was going to happen, it's going to happen soon, while the window from all the things that have happened during COVID is still open, and the large-scale changes are seen as possible still. Number 9 was that innovation is not just technology. And I think this is perhaps one of the most important points coming out of this, is that there is a need for innovation more generally and not just technology. So technology has a big role to play, but if it's not paired with other types of system innovations, then we're not going to be able to harness its potential as effectively as we can. So for example, funding that enables ways of doing things differently. The way money flows has to be able to support innovation, changing over time, evaluating and adjusting, and not just deploying once and not adjusting as we need to. Care models of processes and ways of collaborating also need to be innovative and change over time and adjust to be able to work with technology as it changes and is implemented. And new funding frameworks are going to be essential for advancing any of these types of innovation agendas. And then, so overall, financing innovation needs to be done alongside other forms of innovation in the sector. They can't be seen as separate entities or separate ideas. And then lastly, in terms of key next steps, so the first idea was to develop some sort of long-term care policy navigation portal, so a web portal that would help people navigate the landscape in long-term care, map who's in charge, priorities, issues, evidence about them, and what's happening around the country, and then identifying and coordinating existing innovation projects and examining strategies to help scale up and spread. So lots of people kind of talked about how they had heard of all these ideas around the table, and they didn't know that some provinces and territories were doing them and wanted to take them up, and what needed really a way of supporting that sharing and scale up and spread in other areas to harness those types of innovations. And then lastly, developing an innovation roadmap or agenda that's driven by some sort of a pan-Canadian working group that meaningfully engages citizens and includes policymakers, leaders, technology innovators, and other key leaders in health and social systems. So I'll leave it there. Those are my top 10 insights. I just want to give you a quick update on next steps. So since the dialogue, COVID End, which we co-lead here at the McMaster Health Forum, has since produced a living evidence profile about supporting crisis management and renewal in long-term care. So it was last updated just recently. I'm just working on the final version that's going to be posted either today or tomorrow. So that's updated once per month. So it's all the evidence as well as experiences from 7 or 8 other countries in the world, as well as across all provinces and territories in Canada. We're hoping to also do some further citizen engagement to support innovation in long-term care through a discrete choice experiment, which is focused on identifying preferences for innovations in long-term care renewal and redesign. We're currently working on those plans, but are hopeful we might be able to launch something. And then we're working closely with AgeWell to operationalize actions that were identified, publish our results, and all the typical things that would follow this type of project. So I'll leave it there and turn it over to Andrew. If he has anything else he wants to share. Thank you.
Hi, thanks, Mike. Can everybody hear me? Yeah. How long do I have, Mike? Because you've mentioned quite a lot of material here, and it's been a very insightful project that you've been involved in, and I've got lots of comments. So how long do you think I have?
Sorry, I think Mike's muted, but...
Oh, you're muted.
Sorry.
Yep.
Go ahead, Steve. I was just going to say, I feel like you've got lots of time. I only took about 20 minutes. So
Yep.
if you want 10, 15 minutes, Andrew, whatever you may want,
Okay,
then please go for it.
I'll go for about 10 minutes. How's that? Okay, so yeah, hang on. I've made some notes in all the slides here, which I just wanted to pick up on. So yeah, a little bit about AgeWell on this. So AgeWell has supported this project and was part of AgeWell's renewal plan. Firstly, because this idea of rapid learning healthcare systems was something that, and social systems was something that we thought was a really interesting concept and could be applied to a whole range of problems that AgeWell is dealing with. So AgeWell is Canada's national network on aging and technology. So we've been supporting a range of projects operating in this age tech field, and this project is one of those. And I think it's a really good project in the sense that it's taken to heart a lot of the things that AgeWell is trying to achieve. And Mike's mentioned this idea of community engagement, stakeholder engagement, co-design, participatory approach, really to drive the age tech innovation agenda. So that's something which has really impressed me about this project, and I think is really something that we should take away when we're looking at how to change things within the healthcare systems more generally, but particularly in respect to older adults and caregivers, is that whatever we do really needs to be driven by their preferences, their needs, understanding the context within which they live, etc., etc. So I think this is a really important perspective, and trying to incorporate that stakeholder or end user perspective into the planning and the design process in a more connected way, I think is really important. And it's not just about consultation, but really trying to get citizens and older adults and caregivers involved into the design and the innovation process. So that's a really important thing that I wanted to start with. Sorry, 1 second, I've got some notes to. So yeah, so I wanted to skip through to the key things that Mike's been talking about today. So if we look at the overall problem, and Mike mentioned that there are a range of issues that are difficult to deal with within the long-term residential care sector. I think everybody has been aware recently, because of COVID-19, just what problems exist within the long-term care sector. And I think Mike made the point that many of these things we knew about already. So, for example, issues around staffing, the infrastructure, the basic approach to care, etc., etc. There are many challenges that exist within the long-term care sector. And really, the problems that we've seen emerge during COVID-19 probably highlights that that this was an accident waiting to happen, and unfortunately, it's happened. The silver lining of this is that hopefully it's woken us up to the need to think about long-term care more fundamentally and address the problems that we already knew existed. You know, not just the infrastructure issues or staffing issues, but issues around social isolation, the issues about quality of life in residential care, and how can we think about long-term residential care in new ways that are really going to support a positive quality of life. And it's not just about standards and safety, disease control, but thinking about long-term care more fundamentally about these these ideas of quality of life, social isolation, etc., etc. But also thinking about the issue that long-term residential care, as we currently have it, is actually not sustainable. If we look at the demographics about care and the need for care in coming years, simply reproducing what we have now is not going to be the solution as we go forward. So we do need new ways of thinking about how to support older adults in the community, also thinking about ideas about how to support older adults in long-term care, and what is the potential role of technology in that context. Yeah, one of the things that I would like to pick up on as well is Mike mentioned the lack of an innovation agenda within the long-term residential care sector. In many ways, what one can see that healthcare systems generally, and particularly within the aging sector, are actually not very amenable to innovation. If you look at the models of care, the investment that we have, et cetera, it doesn't give us very much in the way of opportunity for innovation. So we really need to think this in quite a systematic way. And Mike's mentioned things about what can we do in the short term and the medium term and the longer term. And I think I'd just like to come back to that issue of innovation agenda in a little while. Firstly, is that I think there's a lot that we can do in the short term to improve long-term residential care through use of technology. And I think this co-design approach that has been that Mike's been talking about is really important. We need to know what technologies are available, how can they be utilized and improve the ability of long-term care providers and residents to be able to use technology. I'm just looking at slide 16 that Mike mentioned, which was key insights from panels and dialogue, or the 7th key insight. The idea that there is a need to reimagine long-term care using a co-design approach. And I think this speaks to a much more radical agenda, that it's not, we shouldn't be thinking about technology just as supporting the existing model that we have, or doing things that we already do, but in a more efficient way, or a more effective way. That's very important. But I think we certainly need to think about how we can try and look into the future and develop some sort of vision of where we want to go with long-term care and with care and support for older people more generally. And I think there are many large structural and long-standing issues which are going to be very challenging. So, for example, that the long-term care is not one homogeneous group of facilities. There are many challenges because it is a very diverse sector. There are many varied and long-term care ownership models, for example. We need to involve families and residents in this process. But how do we do that? How do we give people more power to have their say within the long-term care sector? just briefly return to this idea of what an innovation agenda would look like. And I think this is important going forward, especially with this idea for a rapid learning healthcare perspective. So Mike highlighted three kind of things that we could be thinking about. Firstly, the incremental innovation that focuses on short to medium term goals for enhancing quality of care and care processes within the existing structure. There's a lot that we can already do in terms of implementing technologies that are already existing, or channeling things that are already in the pipeline for innovation, and helping to support the long-term care sector to adopt those technologies and work with them. So there's a lot that we can do in the short term, for sure. I think also within this innovation agenda, we need to think in this more long-term perspective as well. So Mike mentioned ideas about disruptive innovation. Where could technology be used to significantly change the long-term care sector? So there's a lot of things that we can think about here, where we can focus very much on the resident, on the caregivers. And can we use technology, for example, to provide a more person-centered approach to care in residential care? And what can technology help us to do in that respect? Another perspective on this, and Mike called this radical innovation, is trying to rethink what long-term care might look like in the digital age. And particularly, can we think of alternative models for long-term care in the digital age? And can we use technology that are going to help those models? For example, creating more age-friendly or even dementia-friendly environments that are going to allow people to stay for a longer time in their own homes, or creating intergenerational living environments that help older adults and younger people to stay connected and mutually support each other. What is the role for technology in those kinds of alternative models to the kind of long-term care that we already provide? And finally, I just want to finish on this idea of innovation is not just about technology. This is a really important lesson that AgeWell has learned over the last 5 or so years, is that really technology is about helping people. And we're talking about services which might be technology enabled. We're talking about how to help people to engage better with technology, supporting implementation of technologies, because while we certainly within AgeWell realize that technology has a role, it's not going to happen unless people are able to adopt technologies and use them. So that improving the capacities of individuals themselves, older adults and caregivers, improving the capacities of the long-term care sector to adopt and use technology is an absolutely crucial aspect in this sector. So yeah, those were some of the things that I wanted to highlight there. And I think just to finish is really the next steps that that Mike has been talking about. And certainly the sorts of things that he's mentioned, the development of a portal, a web portal that will help us to navigate the long-term care landscape, identifying what's already in the pipeline in terms of innovation projects and how we can help to adopt those. But I think crucially, trying to develop an innovation roadmap or agenda that is driven by older adults and caregivers and other stakeholders within this sector to really think about where we want to go in the long-term care sector, and to link our innovation and technology agenda to that. Okay, I think that's all I wanted to say. Thanks.
Thanks very much, Andrew, and to Mike as well. Some very interesting points there about linking not only, what technologies could be developed, but also what the demand is from the providers, but also from the people using them. So that's certainly an important part that is sometimes forgotten in these discussions. So thanks for reiterating that. We'll just maybe wait a few minutes here and see if there's any questions in the chat. I don't see any right now, but I would certainly encourage anybody, if you have any comments or questions about today's presentation, to share it there. We will be posting a video from this webinar on our website afterwards so that people can share it with their colleagues and others that are interested as well. But we'll just maybe give it a minute and see if anybody has any questions in the meantime. Mike, did you have anything you'd like to comment on from Andrew's presentation in the meantime?
No, nothing specific, Steve, other than just thanks to Andrew for the thoughtful comments. I do think like the roadmap that Andrew mentioned and the routine involvement of citizens and others in it is a strength of AgeWell, and their commitment to operationalizing that, I think, will be important for moving forward the work in this in particular, as well as in other areas too. So thank you, Andrew.
No worries.
Well, and I think, I think we can all appreciate right now in particular, as we're all forced to maintain a distance, that the role for technology is certainly something that can be very impactful in staying connected and helping to reduce social isolation for sure. Obviously, there's many other factors as well, but I think that's one that unquestionably has been seen as in this last year or so anyways, as a particular one of focus. So. Okay, I don't see any other questions coming in here, so I'll just reiterate again that the recording from today's webinar will be posted online, and we will be sharing it through our channels as well. And just wanted to thank Mike and Andrew again for great presentations, great insights on a very important topic. And we hope that people will join us for future webinars. Thanks, Mike. Thanks, Andrew. Have a great day, everybody.
Thank you.